This video will demonstrate stone management with ureteroscopy. This patient has a stone in her right ureter. The common steps of ureteroscopy are as follows. Insert the cystoscope. Move the scope into the bladder and identify both ureteral orifices. Advance the ureteral catheter through the cystoscope into the bladder. Guide the catheter into the ureter containing the stone. Fill the syringe with contrast material to perform a retrograde pyelogram. Contrast material is injected into the catheter, filling the entire collecting system. It is now possible to detect filling irregularities. Remove the syringe from the catheter. Insert the working wire into the back of the catheter. The wire should coil in the renal pelvis of the kidney or within a calyx in the kidney. Remove the catheter. Remove the cystoscope. Insert a dual lumen catheter over the wire and into the ureter. Backload the safety wire into the open lumen. A safety wire is sometimes used to ensure access is maintained even if one of the wires should become damaged or fall out. Remove the dual lumen catheter. Leave the working wire and safety wires in place. Insert the balloon catheter over the working wire. Observe the radio-opaque markers inside the balloon to designate its location. Inflate the balloon catheter. Deflate and remove the balloon. Insert the semi-rigid ureteroscope over the working wire. Guide the ureteroscope to the stone. Remove the working wire. Insert the laser fiber through the working channel of the ureteroscope. Perform laser lithotripsy to pulverize the stone. Note that a stone fragment retropulsed into the kidney and one remains in the ureter, necessitating additional steps for removal. Remove the laser fiber. Insert the basket retrieval device through the ureteroscope. Advance the basket retrieval device just beyond the stone. Open the basket and sweep back slowly to capture and remove the stone. Simultaneously remove the retrieval device with the stone and ureteroscope. Leave the safety wire in place. Insert the dual lumen catheter into the ureter over the safety wire. Insert the working wire into the open lumen. Remove the dual lumen catheter. The working and safety wires both remain in place. Advance a ureteral access sheath over the working wire. Remove the working wire. Remove the core of the access sheath, leaving in the outer sheath. Leave the safety wire in place in the ureter. Insert the flexible ureteroscope through the access sheath. Use the scope to search the kidney for the stone fragment. Insert the laser fiber through the working channel of the ureteroscope. Fire the laser at the stone until it turns into dust and washes away. Remove the laser fiber, flexible ureteroscope, and access sheath, leaving in the safety wire. Insert the cystoscope over the safety wire. Place the ureteral stent over the guide wire and into the cystoscope. Advance the stent into the bladder and into the ureteral orifice. Use the stent pusher to move the stent to the correct position in the kidney. Stop advancing the stent once the black marker is visualized through the cystoscope just outside the ureteral orifice. Remove the guide wire. The renal coil of the stent forms a coil in the kidney, which prevents the stent from migrating down into the ureter. As the wire and pusher are removed, the stent also forms a bladder coil. A kidney ureter bladder X-ray is taken to confirm proper stent placement, and the procedure is complete.